For all joints commonly injected with Arthramid, I like to use a 21 gauge 1-inch needle. The reason for doing so is that length of needle allows me to access all those joints, and also the 21 gauge doesn't allow Arthramid to be injected through it if you are not within a synovial cavity, such as if you're in a periarticular fat pad and also the synovium as well. So if you still would prefer to use a 20 gauge needle or something a bit bigger, then I would recommend you do a saline test to ensure that you're within the synovial cavity. So the distal intertarsal joint has two approaches to it. The first being the lateral approach just here, which you can feel that is roughly at the head of this lateral splint, and you come forward to this little crease just in here, and then that needle should insert about 45 degrees from the sagittal plane. The other approach for this joint is coming through on the medial aspect, just around the inside here, and you can find just a little nook that sits in between the central tarsal bone and then the gap between the fused first and second and the third tarsal bones. The last joint which you can do, which isn't as common as those two previously mentioned, is the tarsocrural joint, which is this upper joint, the most mobile joint in the hock. And then I often just find the lateral malleolus here, go around the side, being careful of your tendons, and then inserting it just in up under here. But again, these joints will be effused if you're injecting them, and it's a lot easier to find.